Hello.
Hello, hi, Miss Drummond.
Hello.
I talked to you earlier about possibly interviewing you about talking about your child and his disability.
Yes.
Okay, first of all, I want to thank you for actually allowing me, to talk to you about his disability. And from my understanding, cerebral palsy affects the body movement, muscle coordination, position, balance, and reflexes. Is that like
True.
okay? Okay.
Yes.
I understand that Ryan is 1 year old. How did you feel? Did you think that when he was diagnosed with cerebral palsy, did you think that was a misdiagnosis, or was it, real?
Yeah, I was hoping it really was. I was hoping that they got the test wrong because who wants to believe that their child would be born with this form of deformity?
Okay, now, did this was this disability caused during birth, or was it before, like when you were pregnant? Was it when you were pregnant?
Yeah, it was. They had gave me a test and they said it was a possibility that he could, but I was still thinking that maybe
And how did you
the
feel when
test
they
was.
how did you feel when they did tell you that he had it?
Well, I was. It's. I was in disbelief because part of me was thinking that it was my fault. I was thinking that maybe I did something wrong that caused it.
And okay, so after when you thought that it was a misdiagnosis, when did you realize that your child wasn't developing at, a normal rate? Like at what age range? Was it months when you realized that, he couldn't sit up on his
Yeah,
own?
I want to say, yeah, like he has a hard time like sitting up, holding. And he was like when a kid when it's like 3 4 months when a kid should be holding their head up, like he wasn't doing it. Like when it was time to sit up, he couldn't. Hard time holding his bottle. So that's when reality really hit me. Like have to face the fact that he's going to be like a little different.
Okay, and after his diagnosis, did the doctor say whether he would have a full term life expectancy, or, would he be cut a few years shorter than a normal child?
Well, since he's not quite one yet, they was basically just saying he could live a long life, but 9 times out of 10, like it all depends on the child. Like since it affects like his muscles and everything, it all depends on the child. Some children with cerebral palsy do live a long life, and then some don't. But I know in my case, mine he'll live a long life.
Okay, and what are some challenges you and your family has faced um, after learning his disability? Did you have to gain patience of his disability, or
Yes, it's really stressful because I have another child in the house, and far as school, like you have to make sure that you're leaving your child with in a proper hands, and so he is developing as another child. So you want to make sure whoever you're leaving them with, they're skilled to if anything was to go wrong, because like I said, it affects his muscles. So a lot of times he doesn't drink well or digest his food well either.
okay? And are there, if there are any services, are there any services to provide your child as far as like therapy and, medical that helps you pay the bills, or do you pay everything out of pocket?
No, we have insurance through welfare, and right now we're in a program called KinQuest, and it helps out like families that would have the children with disabilities. They come out for it as exercising with them and just helping with his fine motor and gross motor skills.
Okay. Do you feel that those services are successful in his development? Do you see a development or any
Well,
progress?
yeah, I do see a progress, right? You
Like,
know,
is he able
I
to
mean,
now lift
it's
his
just a
head?
slow process, but say it again.
Is he able to like lift his head or drink from a bottle now since receiving therapy?
Yeah, but it's not like where he should be. But everything is slow pace. But slow pace is better than no pace.
Okay, and I know that it affects muscle coordination. So I know it takes muscles to smile. Does he show emotions because of, it takes muscles to show, smile, frown? Is he like just like a blank stare?
Yeah. No, it's not always a blank stare. I mean, sometimes he'll smile and just does it just out of the ordinary. Like it just you just say hi and he'll smile, like. And then sometimes he's just having a bad day and he just doesn't smile or laugh.
Okay, does he try to do anything on his own, like crawl, step?
Yeah, he does, but it's like his upper body strength is more stronger than his lower part. So a lot of times he'll like pull himself like on his forearm.
Mm. Has your family dynamics changed, such as like daily routines? Do you have to prep everything the night before in order to, so you're not as stressed in the
Yeah,
morning trying to get both kids together?
I still have to provide his food, and I have to bathe him. Well, he's not one yet, but yeah, I have to like help him lift his legs and all that, just to have them like make sure his muscles and stuff don't get stiff,
Hmm.
because a lot of times he do have muscle spasms.
Okay, and being as though that cerebral palsy isn't curable and it's not a disease, when he gets of age, how do you think that you'll explain to him that he has cerebral palsy and is not as normal? Well, doesn't function at a rate as a normal child would. How do you think you'll explain his diagnosis to him?
I don't know, because it's kind of hard for me because I don't know everything there is to know about the disease. So the best I know, I haven't really got to that part of how I would break it down to him that he's different.
Okay, and how is the relationship between you and your child's father since learning his diagnosis? Has it like increased, or is there like lack of communication due to stress?
Well, ever since that, Ryan has been like his father really hasn't been a part of our life. So it's like really stressful dealing with a child that has problems and then not having support from the father. And it has really been stressful on that news.
Okay, as far as school, do you think he'll be able to keep up with other students, or will you look into special schools that help him, that assist him with his needs at his own rate?
Well, I was thinking about putting him in a regular school, but I'm thinking I'll probably need to put him in a school where he's surrounded with people that are more like him, so he won't feel like he's not normal. So I think I'd rather have him in a setting where it's other kids that has problems like lying. So I don't want him to be pointed out or ridiculed or anything. So I'm gonna think about like having him bus to a school that specializes in children with disabilities.
Hmm. Okay, and because his father, well, their father is absent in their lives, do you ever feel overwhelmed, like there's too much on your plate to handle at one time?
All the time, all the time.
Um, okay, so since he's going to therapy in the last 6 months, you were seeing like little improvements such as smiling, holding his bottle. As far as like a huge 100%, progress, has there been any in the last 6 months? And how often does he go to therapy? It's like once a week, twice a week. And for how long does therapy, last? Like an hour or two?
Well, he has two different therapists that comes out. So on Mondays he does therapy twice a week, and on Fridays he does twice a week as well. So I think you can total that to 4 times a week,
Mm-hmm.
and each one is for an hour.
Okay. Since learning about Ryan's condition, as far as employment, are you a stay at home mom, or does someone care for him during the daytime while you're at work?
Well, right now I'm looking for a job, so I have my aunt come around and help out with Ryan.
Mm-hmm.
So once I go back to work, I will be trying to find someone that that's certified and taking care of children with disabilities. So I won't have that stress on me while I'm at work, as far as if he's getting the proper care or not.
Okay, now jumping back to their father, like since the diagnosis, have you, contacted him about, staying in the child's life, as being like another supportive parent figure?
I mean, I've tried, but that's another issue. That's another I'm more stressed out, with the two little ones, and then having to go back and forth with him. He blaming me. I just don't have the time for that. So I'm just gonna get that chapter in my life. That book, I'm gonna just leave that closed.
Okay, now, I understand that, when parents first, when first time parents or second time parents find out that they're expecting, they have all these high expectations for their child, such as like graduating college, continuing, getting great jobs, being married, having a successful life. But now that Ryan, has this disability, does your, accomplishments for him change? Is it like, has it like gone from college graduate to, walking as a goal?
Well, not at all, because all my expectations are still going to be the same because I don't know a lot, but I have been reading different things, and it all depends on how bad of it that he has it, and I'm hoping that it's not severe where so it enables him to speak and he won't be able to walk at all. So I'm hoping and pray that it's just a mild case of it where so he still will be able to do the things that the things that I need. Well, hopefully he still can do the things that a normal kid do. He had a slower pace. That's what I'm praying for.
Okay. As being though that you're now a single mother too, do other family members, are they supportive? Do like they help you out in any ways, such as watching both the kids, washing? Do they come over? Like, is there someone else who comes throughout the day to help you take care of them, help you prepare the food, wash clothes, any other things that their father, if their father was there, he would have done?
Well, hopefully if their father was around, he would have picked up and back there, and I wouldn't have looked for people to watch him. But it's this support group that for parents with disability. I'm thinking about signing up for that because they can help me learning more about the disease. And sometimes you just need to talk to another person who's going through this just to see exactly where in life how they wound up.
Okay, now I've done a little further reading, and I know that sometimes children require wheelchairs because their motor skills, or their leg, they can't actually walk. Kids with the cerebral palsy can't actually walk yet, or it takes some time to actually develop that movement of walking. Has there been any modifications in your home, such as like ramps that if Ryan has to use a wheelchair, that'll be accessible to him throughout the house?
No.
So do you feel like that'll be a challenge?
Yes. That's something I really need to look into because I do, I do that better assess my home from expectations.
And I know that you have another son. Does he ever feel left out?
Well, actually, no. When we help him find, we make sure that he's involved. So, he won't seem like, Ryan's getting all the attention, like, far as, dressing. Ryan helps with putting shoes on, tying them, and, he works a lot.
Do you give quality time to both of the children? Because I know Ryan may require more time. So is it like, some things that your other child can do on his own versus having, you having to stop taking care of Ryan to accommodate your other child, or is, the time split equally?
Yeah, like my oldest, he's more independent. Like, he can feed himself. So while we're at the table, feeding Ryan, we're talking, and he's feeding himself while I'm feeding Ryan. Or he'll come over, tell Ryan to open up wide, and he's helping and trying to assist Ryan in eating, and saying you can do it.
Okay, and about your other child, do you feel that he'll ever resent Ryan, as being the reason why their father isn't in their life? You think he'll start to, form a hatred towards Ryan?
No, because no.
Okay, and
No.
is their father's side of the family like supportive and involved in Ryan's life? Well, both of the children's life.
Well, no, not really. I mean, holidays they have, calls or border gifts other than that. No.
Okay, and jumping back to when you said you go to supportive groups, does being as though that he has a disability, does welfare provide those financial coverage for you going to the supportive group, or is the supportive group free and open to anyone who has a child with disability?
Well, that's a good question. I don't know. I'm just that is free for anybody who has children with disabilities.
Mm-hmm. As Ryan gets older, do you feel that he'll be fully able to operate and live on his own, or do you feel as though you'll have to take care of him until you can't anymore, until you get it old enough where as though is at a point in your life where someone has to take care of you now?
Well, again, I'm going to hope that, once if I get him the proper care, that he will be able to, do things on his own. I mean, it may be a little harder, he has a slight disability, but I'm hoping that, he'll have a normal life, or as, in the person taking care of himself and, living on his own. But, if not, then, I'll be here for him for as long as I can.
Okay, when Ryan gets of age to maybe preteens, do you feel that he'll be bullied or, separated from what normal looks like? And, like, do you feel that kids will tease him saying, you're not as normal as we are, or, use like explicit words towards him?
I mean, he may feel that way, and then the way society is, that children teasing children. So, just let him know that, you was made this way for a reason. And, I'll just reassure that he's perfect. I mean, I'll let him know that, everybody has, some type of disformity. And hopefully, it doesn't affect him. That's what I'm looking at. Like, but it won't affect him.
Okay, and jumping back to when you said you guys receive welfare finances, because he has a disability, will he have coverage throughout his life, or is that like until he reaches a certain age?
It's throughout his whole life.
Okay, and do you feel like Ryan will meet, just as well as your other child? Do you feel like he'll meet someone who's compatible with him, or will he stick, to people who are like him? Will he categorize himself as disabled? So I have to stick with people who are disabled, or you think that he'll socialize and reach and branch out into society, or will he just be like a loner and feel as though that because he has a disability he isn't like everyone else, so therefore he should exclude himself? Or do you feel he'll be, like a normal child, socializing?
And, I'm glad that you asked that question, because that's the same question I was thinking to myself, like, rather when he's able to go to a school, if he's able to, keep up with the regular kids, should I exclude him from the normal kids, per se, or put him into a category where there's children more like him? So I'm glad you said that, because that's the question I was asking myself, like, should I exclude him from, folks say the normal world, and isolate him? So that question, I'm going to have to just leave him hanging with it, because I'm not really sure how he will feel, because I'm still not sure that it'll be what I want from him. I don't know if I want him, in the population with, normal kids, as people say, or do I want him just, isolated with the children that have disabilities?
Okay,
So
and mhm. And I understand that cerebral palsy affects the speech and hearing and possibly vision problems in many patients. Many people, many children and patients who do have cerebral palsy have no learning disabilities and have normal IQs. Do you think